So we have a patient here today who deals with a lot of back pain here, typically because of being a firefighter. You get a lot of calls, so loves coming in, getting treatment, always feels great after his adjustments. So we're always working the mid back here, but also checking the neck and low back because everything is connected here. So usually we want to check the low back here first. And this patient also did have an ACL injury. What was that, last year?
Yes.
Yeah, so that also kind of threw a little thing off with his hips, so we're always double checking to make sure. And I'm not sure if you can see on the video or not. Sorry, we'll edit that out. His right hip sits a little bit higher, which means that this leg right here is being pulled up, rocking this hip up. This left hip is dropping down, so we're going to work that right hip here first. And now as we're doing this, the table also helps us adjust this area on the patient, which is nice and easy. And no discomfort, is there?
Nope.
Okay. And next we check this area here. So this is right where the muscles connect here. They're called director spinae muscles. So they connect here down to the hips. So typically on patients, especially this patient, this area is really locked up. So I'm going to take a deep breath here and all the way out. There we go. Nice release. And then we're going to do one more here and then all the way out. Good. All right, actually I'm just going to have you drop your arms here as well. I know with this patient, typically there's a lot of shoulder discomfort as well, as I see you nodding there, so just checking here as well. Good. We'll do one more here. There we go. And you can bring your arms back up if you want. And the other thing we're going to be doing here real quick is looking at the low back and the lumbar areas. So this is called flexion distraction. So what this does here helps open up the disc space in the lumbar area. Now, as I do this, there may be some movement in the lumbar area. Not that that's what we're looking for here. We're trying to stretch this area out. This takes pressure off the disc, which takes pressure off nerves, and those go down the entire leg, known as the sciatic nerve. You've probably heard that before. So this is a nice stretch, and most patients really enjoy this. And I'm gonna have you lay on your side with this side up here first. Try not to use your name again. All right. And now as I was doing, I was feeling a few different spots here in the low back, and I was feeling a lot of tension here. So we're gonna just check the low back here again. So you kind of roll just a little bit here. Good. Get you in. And so make sure you're doing okay with that pressure again. Okay. There we go. Now get you on your back here. Hey, quite a bit going on today. Which is no surprise, as usual. All right, and the last part I'm checking here is the neck here. Now, the reason why we always check this area is because everything starts from the brain, goes all the way down to the low body, into the legs. So again, if we don't adjust this area, this can be off and affecting all the other muscles and the structure in the spine here. It's the right side first. And one more on the left side. And there we go.